Thank you. So I've been researching the field of social care for older people for more than 40 years. So I'm going to start with a very personal overview, which should provide some background for the rest of the debate. So if we go right back to the beginning of the welfare state, social care was always an afterthought. It used to be called the personal social services. And it was an afterthought because in a liberal, familist society like Britain, the services provided personally were considered to be the responsibility of the family, and it wasn't the role of the state to intervene at all. Well, of course, the state did need to intervene because some people needed care and they didn't have families. So over the early life of social care, there was this constant debate between community and residential care. And as you can see from this presentation, famously, Peter Townsend in the early 1960s investigated residential care, which was mostly large institutions in old workhouses, very paternalistic regimes, and stigmatized, therefore. So the residential home was the last refuge. Then the debate shifted to community because of the critique of residential care. And then the discussion was, do we mean care in the community or care by the community? And of course, the government wanted care by the community, whereas those representing older people wanted care in the community provided by social services. When I looked at this first in the early 1980s, I concluded that there was no such thing as community care. It was and actually remains care by families, and within families, it is overwhelmingly still care by women. And then the debate shifted because of the cost implications of increasing residential care to aging in place. How can we keep older people in their own homes for as long as possible and avoid residential care? Next one, please. So I was asked in the mid-80s by the local government association to review community care for older people. And just looking back for the purposes of this webinar, I was struck by how contemporary my conclusion was. I apologize for the self-reference and apologize for the old usage of elderly people rather than older people, but I concluded back in the mid-80s that there was a crisis, and it wasn't caused by growing numbers of older people, but it was caused by the fact that the then government was withdrawing resources from social care in particular, and it was withdrawing resources at the same time as the need for care was rising. Next one, please. Now the care gap has continued to widen, and it is widening as we speak. On the one hand, as you can see, there is a growth in need. That is those people who are experiencing difficulty with at least one activity of daily living, ADL. And particularly the expansion of very elderly people, 85 and over, up to 50% who have frailty. So need is rising. But on the other hand, there are severe shortages of the supply of social care. Just a reminder, in the first bullet point under supply, the majority of older people receiving care either get it from themselves or family and friends, or they have no help at all. And that remains to be the case. And as you can see at the bottom bullet point, the National Audit Office has pointed out that government funding for social care fell by over a half between 2010-11 and 2019-20. Next slide, please. So as a result of the shortage of resources since the 1980s, it must be said, social care has always been tightly rationed. So go back to the 1970s, around about half of older people assessed as having moderate need, a moderate level of need for care, received home help support funded by local authorities, sometimes with means testing. But today, none of those with moderate need get support. It's only those with substantial need. And because these services are provided locally and funded sporadically, we find there is a significant variation of unevenness in the supply of care between different areas. That means that an older person with the same level of need in one place will get a very different level of care to someone with the same level of need in another place. Next one, please. Now, I put this slide up to serve as a reminder that older people are not just the passive recipients of care, they're also the active agents in their own care, because most care is self-care, but also, as you can see from this slide, in providing care to others at the far right-hand side, that is usually for spouses. Next one, please. And in this slide, I've tried to summarize why social care appears to be in a constant state of crisis. So it was never rescued from its Cinderella status. It was never put on the same level as the National Health Service. There's always been a presumption that families can care. That's never been fully challenged, and it's often reinforced by certain racist assumptions. I've heard, for example, providers say that, oh, people in the Chinese community look after their own older people, they don't need support. Cost efficiency has always been given precedence over care quality, especially in the 1980s in the privatization of residential care. But actually you can track that all the way through to the present day. Aging in place as a goal was never properly funded. Sufficient community resources were never provided to enable people to live independently in their own homes with support from social care. The need for risk pooling to fund social care like the NHS has been avoided for decades, and it will probably go on being avoided, even though we're promised a white paper on the funding of social care. The social care workforce has never been adequately trained, paid decently, or valorized. Apologies for the typo there. Prevention and rehabilitation has never been prioritized. Once, far back in the history of residential care, there was some rehabilitation, but no one comes out of residential accommodation rehabilitated these days. And there has never been a long-term vision. In short, social care has never been a political priority. Next one, please. And that point was summarized in a recent report by the National Audit Office that came to a rather damning conclusion that there's a lack of vision, short-term funding, meaning that local authorities can't innovate, they can't plan for the long term, and investment in accommodation and the workforce has been constrained as a result. Next one, please. So I think all of those failures, stretching long back into the past, inexorably bring us to this current graph. The recent austerity policies and deep-seated ageism, all of them are demonstrated in this horrific death toll in care homes between 2020 and 2021. Mostly in the two waves that you can see, with COVID driving up, not just those deaths that can be related directly to COVID, but to other causes as well. Some 40,000 older people who are resident in care homes have died over that period. That is a truly horrific death toll, basically as a result of the failure to protect care home residents. And you've heard since the Dominic Cummings statements in Parliament, many excuses offered why this failure to protect care homes and that nonsense of a protective ring being put around care homes in the first wave, not even in the second wave, as it happens. But I think the key factor underlying this, and much of the low status of social care for older people, is basically institutional ageism. And if you show the next slide, please, Natalie, I've argued this in a recent blog, that there are immediate factors that explain the low status of social care for older people, but there is this underlying notion of ageism, that we should not be investing significantly in a population aged 80, 85 and over. Okay, so that's my quick run through by way of background. Thank you very much for listening, and thank you, Natalie, for taking us through the slides.